Today I spend a lot of time sitting around, and when I spend a lot of time sitting around, I get bored and I post on Facebook. You'll notice that when I'm not at work, I actually don't post on Facebook too much. I'm usually out hiking or whatever. Anywho, I started 2 discussions kind of healthcare related today, and I felt I should make a video in response to the discussions I was having, because it's just going to be too time consuming for me to sit and answer everything, because I had to take some time off to, I don't know, go do my job. So yeah. So first off, we talked about, well, actually the second thing I posted is what I'm going to talk about first, and that's rights. What is a right, and why healthcare is not a right? Now, don't conflate what I'm saying. I am not saying that people should not have access to healthcare. I am not saying that I don't want people to have access to healthcare. I'm not saying any of that. I am simply saying what is a right versus what is not a right. And it is a pretty basic thing. But first off, you can make the argument that the government says that we have rights. I don't actually like that argument, because I don't think rights come from a person. But sure, the government says we have rights. The Declaration of Independence says we hold these truths to be self-evident, that all men are created equal, and they are endowed by their Creator with certain unalienable rights. Among these are life, liberty, and the pursuit of happiness. Now, then we have the Bill of Rights that goes on to guarantee some specific rights. What you'll notice is that the rights in the Bill of Rights are not guaranteed as positive rights. They're not, we will provide these things. The U.S. government is based on a foundation that you have the right to be free. And as such, there are certain things that the government will not restrict. The right to free speech is a negative right. It is saying that the government will not restrict your free speech. The right to bear arms, the right to not house soldiers in your house, the right to freedom of assembly, freedom of the press, freedom of religion, etc., etc., etc. The right to not incriminate yourself. There's a common theme here. They're all things that the government will not impose on you. They're not things that the government will provide you. The government, or the founding fathers, said that your rights are life, liberty, and the pursuit of happiness. They didn't guarantee the happiness. They give you the opportunity to pursue happiness. You getting happiness is on you. So for me to look at what is a right, it's basically something that does not affect another person. So the right to life, you have the right to life. You have the right to not be killed by somebody. Got it. I mean, I think we all agree that life is a right. The right to your stuff. You have a right to your stuff. If you own something, like, I don't know, I own this phone. It's mine. You can't take it. You can't have it. It's mine. I didn't take it from anybody. I purchased it. Me and AT&T entered a contract. I paid AT&T. AT&T gave me the phone. Apple produced the phone. They gave it to AT&T to sell. And they had a contract. These are all voluntarily entered contracts. So that phone is mine. You cannot have it. I mean, I can choose to give it to you, but you can't take it. I would say the right to liberty. That starts getting a little weird. But yeah, you have the right to do whatever the hell you want, basically, as long as, as long as you're not infringing upon somebody else's right to life, liberty, or their property, right? I mean, that's pretty basic. So we can look at different things, and do they pass the smell test? Well, no, pretty much nothing else does. Healthcare, food, clean water, education. These are all things that everybody needs, but they're not rights. Now, having access to these things is a whole different thing than saying you have the right to it. Saying you have the right to healthcare would mean, the way that I would understand rights, and the way that I understand the language of the Constitution and all of that, is for a right to exist, the government is guaranteeing. The government is guaranteeing that right. So that means that they would guarantee you healthcare. Now, how can you guarantee healthcare? Healthcare is a commodity. Somebody has to provide healthcare. So healthcare is provided through doctors and drug companies and companies that produce MRI machines and the janitors at the hospital. And I mean, all of these people all come together, and the whole net is healthcare. So they provide healthcare. Now, what if you can't afford it? And then the government is guaranteeing it. So they're going to force these people to provide this service. That's violating their right to be left the hell alone, basically. Their right to not provide you something for free. So you could say that they're going to be forced to provide these things, and you'll be compensated with tax dollars and all of that. That's not a right. You can do that with anything. You can say you have a right to plumbing, you have the right to water, you have the right to friggin' ham sandwich, whatever. And the government can provide these things and rob somebody else of either their time, their effort, their money, however you want to. I mean, money, in my opinion, is like a measure of time. I mean, it's a whole other argument, but you're taking somebody's time away from them and forcing them to provide a service for somebody else. And that's not how rights work. So healthcare is not a right. It's just not. Now, I am not saying that you shouldn't have access to healthcare, because I don't agree with that. I believe you should have absolute access to healthcare. And I have no problem with the government helping some people out that are in need. I think we take that way too far. We help out a lot of people who don't need help, and that creates a whole smorgasbord of other problems. But that's neither here nor there. I think we should help people. I think that the government assisting with Medicaid, whatever, we're not going to roll back the systems that are in place. We're not going to take these things away from people, so it doesn't matter. But they're not rights. You don't have the right to healthcare. So moving on, I asked people about single payer. Should we have a single payer system in the U.S.? And I'm actually pretty shocked that apparently all my friends are crazy socialists. Just kidding. But they all think we should have a single payer. And with that, I don't even know. So no place in history has centralized government planning ever made a system more available. Like, it's just not how that works. Whenever the government starts regulating a specific sector of a country's economy or whatever, the things that it's providing now becomes more scarce. And so when the government starts providing healthcare becomes more scarce. Or the quality suffers, which I think in the case of single-payer healthcare is what happens pretty much universally. So Ben Shapiro likes to say, and I'm not sure if it's his words or if he got it from somewhere else, but healthcare can be two of three things, but it cannot be all three. It can be universally available, it can be affordable, or it can be high quality. But it can't be all three. So most countries that pick to have socialized healthcare pick universally available and affordable, and then the quality suffers. There are some exceptions. Switzerland, for instance, has kind of a funky system where you pay ridiculous amounts of insurance, but you get pretty good care. So, I mean, it's not affordable, but it's good quality and it's available. In America, we have universally available, pretty good care, not cheap. Is that right? I mean, maybe we should have a discussion about, do we want to have less care in exchange for making it more available? I don't know. So there's this weird notion that exists, I guess, amongst my friends, that I'm reading their posts, and they seem to think, and I don't know, is this what you guys think? That if you go to the doctor in Britain or Germany or Canada, and you come down with a bad case of AIDS or whatever, you get in a car accident and you have like severed your spinal cord, that the government healthcare is going to provide you the best care available indefinitely. That's just not a thing. That's not a thing in any of these countries. The government healthcare will provide you the basic healthcare that you need to like get on with your life, and then you suck it up and drive on. They're not going to provide you this magical high standard of care. It just doesn't exist in any of these countries. And I don't even know where that notion comes from. Is that what you guys think happens? Do you think that if you have leukemia and you are born in Germany, that you just get treated for leukemia forever and you get the best care that you could possibly get anywhere in the world and life is great and puppies and kittens and all that? It's just not what happens. You get substandard care. Like at some point, like your care is gonna start dwindling down, and you're gonna get the basic amount of care that you can get to pass you off, just like in the U.S. Just like in the U.S. So in the U.S., if you have no health care at all, if you have no health insurance, and you get in a really bad car accident, and you go to the emergency room, you're going to get treated for whatever life-threatening things are going on. You're going to be stabilized and you're going to be shipped out. Now, in some of those other countries, you might get slightly better care than that, but you're not going to get the same care that if somebody, well, I mean, I have a pretty decent health insurance plan, apparently. I haven't had health insurance for the last few years, but I do have health insurance now because of my current job. Allegedly, I have a good health insurance plan. I really don't know that much about it. So I assume that I would get if I, was in a car accident and needed treatment or whatever. Or somebody mentioned a plane accident, which isn't really cool to joke about. That's messed up. But anyway, let's say I was in an accident and, I needed some treatment. I would probably get a pretty decent standard of care. But if I couldn't afford to pay, I mean, I'm going to get a basic level of care and then be shipped out. That's what's going to happen. That's just how it is. If that happens in Germany, that's what's going to happen. That's what happens. You get a pretty basic level of care, and you get shipped out. Now, what I don't understand is why we are so opposed to free market solutions to healthcare. So I keep on mentioning this place, the Surgery Center of Oklahoma. So the Surgery Center of Oklahoma is a cash-only place in Oklahoma where a bunch of doctors came together and they offer surgery at really, really, really cheap prices. Basically, you have to pay them and they don't accept any government funding, so they can charge whatever they want. And they basically do it so the doctors are making a profit, but they're not making that much of a profit. They're not robbing you blind, but they're doing the surgery more or less at cost, and then you get an invoice. So like, I don't know, I'm just kind of spitballing some numbers here, but let's say you need to have a knee surgery. You have to pay for the facility, and you have to pay for the parts that are put into you. And you have to pay a few doctors and a few nurses their hourly rate, and the surgery is going to last 4 hours, and blah, 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 blah. Here's your bill. So I looked up something. I looked up a rotator cuff surgery. At the Surgery Center of Oklahoma, they go on their website, and you have to have open rotator cuff surgery. It costs $6,149. And then you can read about what exactly you get with that $6,149, but you get your rotator cuff fixed. According to PubMed.gov, and this is the latest numbers I could find. I didn't dig around too much, but this was in 1995. So this is literally 22 years ago. I'm sure that the cost has gone up since then, but the average rotator cuff surgery in the United States in 1995 was $50,302.25. That's almost 10 times more, and that's without counting 22 years of inflation. I'm gonna guess that the average rotator cuff surgery now probably is more like $70,000 to $80,000. Why does it cost so much? It costs so much because of the government bureaucracy, because of all the moving parts that the government has. You want to look at single-payer healthcare system, look at the VA. So I know, John, you love the VA. I got it. But most people who are VA patients do not love the VA. I did not have healthcare for a couple of years, and I attempted to use the VA system because, well, I mean, I'm a veteran and I earn that, blah, blah, blah. And it was just too damn frustrating. Like, it took months to get in to do anything. It took months to get seen. When I went to the VA in Connecticut, and I showed up there, and I enrolled, and I filled out all the paperwork, and then they told me to make an appointment, and I called and made an appointment, and I couldn't get an appointment for like 45 days. That's absurd. 45 days to see my doctor. After I saw my doctor, I then had to take a bunch of blood tests, and I couldn't get in to see my doctor again for another 90 days. So after like 5 months, I was like then enrolled in the healthcare, and then I just kind of gave up on it because what's the point? I mean, if it takes that long to get anything done, I just have better things to do with my time. I don't need to go to the doctor. I'm probably not dying. So whatever. But the VA serves about 7 million or 8 million veterans. The latest numbers I saw were 7 million, but it was also like 5 years ago. So we can maybe say that's probably closer to 8 million now. So they have 8 million patients. By the way, the nation has 320 million people. 8 million patients. The VA employs 340,000 people. So if 8 million people, that's 1/40th of the population of the US, maybe times, or 340,000 times 40, we're looking at 12 million. We need 12 million freaking employees. That's absurd. That's outrageous. So you're going to need 12 million people to staff this thing. That would mean that, what is that? That's like 5% of the national population is, well, more like 3%. Oh, 3 out of every 100 people are employed by the healthcare system to run the healthcare system in the U.S. That's outrageous. So then you look at what the budget of the VA is right now, and I don't know the numbers, but I'm not lying. I just haven't looked them up in a long time. But it is the second largest branch of the government, budget-wise. Second only to the Department of Defense. So there's the Department of Defense, number one, and then number two is the VA. I mean, it's already outrageous. So now we're going to take and nationalize this whole thing and make it for everybody. How much is that going to cost? And then there's the Denmark problem. So everybody wants to compare America to Denmark. America isn't Denmark for lots of reasons. America's way better than Denmark. Denmark sucks. But Denmark has a couple good things going for it. Like the people there are allegedly happy. I don't actually know if that's true or not, but that's alleged. Denmark's a very small country, both in size of population and in size of area. Bernie Sanders likes to come out and say that Denmark's a socialist country. It's not socialist at all. It's simply not. They have a very free market economy. They have very low corporate taxes. They do have a high taxation system, and it's ridiculous. I believe that the numbers are roughly 50%. People pay roughly 50% income tax, and it doesn't matter if you are Sandy school teacher or Joe the plumber or a hedge fund manager. You're paying 50% taxes, which, to be honest, I like the flat rate tax system. I like everybody paying their fair share because I don't know why the Koch brothers need to pay a higher percentage than me, and I need to pay a higher percentage than somebody who works at McDonald's. I don't understand. But either way, they have a pretty well flat rate tax system there. And then they have a 25% value-added tax on everything that you buy. And so everything costs more, even though wages are generally lower than in the US. So people make less money and things cost more. Everything costs more. I believe that the number is 180%. Cars cost or have 180% import tax on them. There are no Danish-made cars. So that sucks. 180% tax. That's crazy. I mean, you're paying 3 times as much for the same car. So, I mean, those numbers are ridiculous. I don't know why people want to do this. Yes, you can go to college for free in Denmark. I got it, but you can't pick whatever you want. In America, you can get your bachelor's degree in underwater lesbian poetry with a focus on Guatemalan art. In Denmark, you have to apply to a specific program, and then they put you in a program, and then you study it. I believe if college should be free, that it should be monitored like that. I don't think it should be free or you should be forced to do anything. I think you should be free to do whatever the hell you want and make your own choices. So, yeah, I don't think Denmark's so great. I don't want America to become Denmark. I do know that in places like Canada, so Canada is always brought up. Canada, you don't get a family doctor. I mean, there are towns in Canada, and you can read about this, where there's only so many family doctors, and so the mayor every year will like have like a lottery to see who's going to get a family doctor, and then they'll call up some families and like put them on the list, and then now you have a family doctor. The standard of care in Canada is terrible. A lot of Canadians come to America for surgery and for things because in Canada, you need this thing. Well, okay, we'll get you an MRI in a year. In a year. In America, you need an MRI, you get a damn MRI. Might cost $10,000, I don't know. But if you need the MRI, you go get the MRI. So in Canada, you don't get the MRI, or you get it after a while, and then you may die in the meantime. Like there's tons of anecdotes, and I don't like using anecdotes to like proof points. I don't like this whole appealing to emotions argument. That's not a freaking argument. Like use facts, use logic. Don't use emotions. Emotions don't make an argument. You do not win an argument with emotions. But in Canada, lots of people find out that they're about to die. And they come to the States where they can get treated, and they get treated, and they oh, hey, it was really easy to fix that thing. Let's just fix that thing and pay your $10,000, and you move on with life. Collect pass go, collect $200, whatever. So this notion that the Canadian system is amazing. I mean, like, talk to the people in Canada. I'm sure some of them like it. I mean, obviously, but a lot of them don't. And that's why you got rich Canadians and rich British people coming to America to have surgery, because the systems there are slow and they're overburdened and they're antiquated. And in America, like, do you ever notice that everything medically related is invented in America? They don't invent drugs in Germany. They just don't. They don't cure cancer in Germany. The cure for cancer comes from America. The cure for AIDS comes from America, because with a free market, there's incentive. You spend your time and your resources trying to fix this problem. And if you do fix this problem, then you're going to be compensated for your time and your resources. 90% of drugs in America, or that come out in America, come from the private sector, even though there's tons of government laboratories and tons of government testing, stuff going on. They only account for 10% of the drugs that are produced. It's not a very good system. And then there's this that people seem to forget. America's a huge country. 320 million people. Yeah, got it. It's big. But I'm talking about like how spread out it is. How do you guarantee service for everybody? So the U.S. Postal Service guarantees service to every American. And because of that, the U.S. Postal Service is like literally one of the most inefficient organizations that exist anywhere on the planet. It is a terrible organization. It loses billions of dollars every year. Just pisses away money because they keep post offices open that don't need to exist and whatever. So how do you guarantee somebody the same standard of care that lives in Manhattan versus, well, where I am right now? I'm in Aberdeen, South Dakota. So how do you guarantee the same standard of care? I mean, I don't know how far the nearest big city is to where I am right now. I'm guessing it's probably Minneapolis. I would guess it's a 6-hour drive to Minneapolis, maybe less. But I don't know. It looks like it's pretty far. So how do you guarantee that same level of care? What if you live in I don't know, Casper, Wyoming? Actually, Casper is not that far from Denver, but you're going to be hours from a major city. Are you going to have the same facilities available to the residents of Casper, Wyoming, or Billings, Montana, that's available to the residents of Manhattan? I don't think that's going to be the case. I don't even know how that would be possible. How about the residents of St. Croix? They're Americans. Or does it only count if you're in one of the 50 states? So, okay, screw St. Croix. What about Bethel, Alaska? Or what about Adak, Alaska? So Adak's a town. It's in the middle of nowhere. It's like literally, it's on the Bering Sea. So what if you live on Adak? Do you get the same level of care that the people in Manhattan get? I'm guessing you don't. Well, that's not fair. If it's a right, everybody should get the same level of care. In Denmark, it's much easier to provide that because In Denmark, you're 2 hours from Copenhagen or less. Like, Denmark's tiny. The U.S. isn't. The U.S. is a massive country with a massive amount of population. And again, who's going to pay for this? So I don't. If you can make an argument to me that convinces me that single payer is a good way to go, I'm willing to change my mind. I've changed my mind about many things in the past. I didn't used to be a libertarian. I didn't used to be pro-gay marriage. I didn't used to be pro-choice. I didn't used to be anti the war on drugs. I mean, all of these things. People have challenged my point of view, and they had a better argument than me. And so I saw that they were right. I was wrong. I adopted their argument. I'm totally down with that. So if you think that we should have a single-payer healthcare system, tell me why. Like, coherently put it out there. This is why. And because feels isn't why. That's not a freaking argument. I don't care that somebody is going to go bankrupt because they got leukemia. I mean, I do care in the sense that, like, that sucks for that person, and there are many ways to help that person out. And if that was somebody that I know, if somebody that I personally am invested in, like a family member or a friend, is experiencing something like this, I'm a pretty generous guy when I can be, and I definitely have given lots of money to people to help them out in the past. Like, it's not a thing that I mean, even when I didn't necessarily have the money, that's what we do. That's what you do to help people out. We don't need the government to rob Peter to pay Paul. We need people in America to have individual responsibilities for their actions and to help each other out. Part of the reason healthcare is so expensive is because, people abuse the system. The system that's in place. Like, little Timmy has a runny nose. He doesn't need to go to the emergency room. Little Timmy fell and bit his lip and it's bleeding. He doesn't need to go to the emergency room. When I was a kid, like and I wasn't even a kid that long ago. Shit, when my dad was a kid. But when in the 60s, when kids fell and got hurt, they fell and got hurt, and that was that. The kids were sick. They just didn't go to school. That was that. I mean, like, yeah, if the kid has a broken arm, send him to the emergency room, but a bruise or a small cut, whatever, just rub some dirt on it and drive on, man. That's what happens. But people go to the emergency room for things that aren't emergencies. People expect health insurance to pay for things that aren't what insurance is for. And so it causes the system to become to have to grow to deal with all of these things that it's not designed to deal with. Insurance. When you have a car insurance is designed to deal with problems that arise after you buy insurance. So first off, this notion of pre-existing conditions, like, not to be a dick, but if you have a house, like I own a house, if my house catches on fire, while it's on fire, I can't call up USAA and be like, hey, I need some fire insurance for my house because it's on fire. They're going to be like, well, that sucks. Good luck with that. And then I'm out, because the insurance company is betting that my house isn't going to catch on fire. It's a pretty poor bet if it's already on fire. So an insurance company isn't going to, or shouldn't, be like, oh, well, hey, John, you have, I don't know, AIDS. I don't know why AIDS, and people don't even have AIDS anymore, really. But you have AIDS. AIDS. And then he's like, oh, yeah, so I need some health insurance now. I mean, they're kind of betting on you not getting AIDS. If you already have AIDS, it's not insurance. By having the single-payer healthcare system, you allow people to, not single-payer, by having this pre-existing condition clause, you allow people to abuse the system, because people like me, I didn't pay for health insurance. I paid a fine when I paid my taxes, but I didn't pay for health insurance because it was retardedly expensive, like, just outrageously expensive. It was like 60% of my monthly income, because Alaska only has one insurance company. So when I went to the Obamacare marketplace and I was employed as a flight instructor, I did the little thing, and it was like, oh, hey, to get a decent plan, you need to pay like $2,000 a month. Well, shit, I only made like $3,500 a month. and I need to pay $2,000 of it, and that's pre-taxes. I need to pay $2,000 of it to the government for healthcare, or not to the government, but to healthcare insurance. That's crazy. I'll just pay the $600 fine and not have health insurance and not go to the doctor. I mean, whatever. Not the end of the world. I'll just not get sick, and if I do get sick, I'll just deal with it because I can't afford that shit. And it's such a bizarre system. So, yeah, kind of lost where I was going with that. Either way, those are my thoughts. Please, by all means, tell me, why should we have a single-payer healthcare system? Like, spell it out there. Because feels isn't an answer. Like, I don't need to know that somebody's going to go bankrupt. I made this argument earlier, but I own a house and my tenants kind of did me wrong, and my house is currently empty and it's costing me a lot of money and it could potentially bankrupt me. And I compared that to somebody who made the argument that their child was born with a birth defect, and if they didn't have insurance, then they would have been broke trying to treat their child. And I made the argument that, I mean, you chose to have a child. You know that when you're having a child, there's a risk that your child can be born with a birth defect. You took that risk. You chose to have the child. You then did not win the lottery, basically. And that's really unfortunate, and that sucks, and I got it. But why should I have to pay for that? Why should I have to pay more because of that? I bought a house, and I rented it out, and then I did not win the lottery, basically, and my bad luck can also potentially destroy me. Are you going to pick up the slack and make sure that I'm not financially burdened by this? Because my choices didn't work out so well. It's the same argument. And I know that the response I got to that is, that's not relevant. Well, no, it is actually relevant. It's a complete apples to apples argument, or apples to crab apples argument, at least. My decision resulted in either a positive or a negative. It went negative. Your decision resulted in a positive or a negative. It went negative. Both have the potential to cause us to go broke. And you expect the government to help you, but don't expect the government to help me. It's not a good argument. It's not solid. I'm all about consistency. So anyways, what do you think? Let me know. I'm tired of talking. I'm going to drink some water and go to bed. So, yeah, bye.